And good morning, everyone. I guess good afternoon to those of us on the East Coast as well. I'm excited to be here with you virtually on day 2 of our Flex Reverse site visit. I think the first time that we've done a virtual meeting ever in the history of Flex. So I'm really excited to connect with you online, although I'm missing the in-person opportunities that I look forward to so much when we have our Flex meetings every year. I took the 2020 vision theme and made some kind of silly slides, so you'll just have to bear with that silliness, but just to kind of highlight where we are now and talk about where we're going. So looking back, we've had a lot of changes on the Flex team since last year. A whole new team is on board now. So wanted to kind of talk about that a little bit. Just to recognize all the great work that Natalia and Tori have done over the past few months, not only getting up to speed on the Flex program themselves, but really making sure that all of you on the grantee side get as much coverage, hopefully that you would, if we had a full team. But we are very excited now. Officially, as this meeting started, as Tori mentioned yesterday, we have a full Flex team. So we're really excited to have Laura and Talia join us as well. I also just wanted to mention that one of the things that we really talk about as a selling point for working not only in the hospital state division, but within Flex, is all of the great work and insights that all of you have as Flex program coordinators. Some of you who've been around since early on in the program, really having those insights and helping us figure out what are the best ways that we can make this program successful. And then all of you, even if you've only been on for a few months, just the passion that you bring to really see what we can do to make the Flex program as effective as it can be. In this, I guess the other change I wanted to mention too is that Mike McNeely, who was a longtime member on the hospital state division, was the division deputy director for about 10 years. He missed last year's meeting because he was on detail for working on the opioids response. Now he has a new role as the director for the Office for the Advancement of Telehealth. So we're really excited to see him in that new role, have a champion for all our HSD programs. I know he's gonna try to do a lot to link up telehealth with our programs on the division. Of course, we miss him and all his expertise that he brought to the division as well. I also, in the last year, being down staff and trying to get new staff on board to make sure that we're all educated about all the complexities of Flex, really appreciate and value all of our Flex partners that help us with this work. So for the Technical Assistance and Services Center team, all the work that they do, putting resources together, bringing folks together, such as with this meeting, the work that they've done recently around population health, really, making sure that you all have resources that you need that help you working with your hospitals and help your hospitals in implementing those programs. I also really want to recognize them for the work that they did, taking from this Flex Reverse site visit with the vision of 2020 and then all that came with COVID, not even knowing, what was going to happen when we talked about this six months ago, and being able to figure out how we can do a virtual meeting to bring together the elements that make this virtual meeting or the usual Flex grantee meeting so beneficial, of learning about what other Flex programs are doing and being able to network with each other and really figuring out how is the best way that we can still do that virtually. And I think from the sessions yesterday, you all saw that, while it maybe not be quite as great as in person, I feel like there's still a lot of that connection. So thank you for all the task team for your work to make that happen. I also want to recognize Nicole Clement, as Christy Edwards had her family issues that she was dealing with and has been out since basically October and then eventually stepped down. Nicole has done an amazing job just helping to keep EMS going, particularly around the EMS supplements. So thank you, Nicole, for that. And I know Talia is excited to come on board and connect with all of you, particularly around the EMS issues, and keep that momentum going. I'm also grateful for all the work that the Rural Quality Improvement and Technical Assistance team has done with putting together all these important quality resources, reporting resources. The team at Stratus Health is amazing. And then with COVID happening, kind of trying to see what shifts need to happen with those resources as hospitals are kind of focused energies elsewhere working on COVID. How can we shift the work there as well? They've also been so helpful for us, particularly as we're thinking about this MBQuip refresh, which you heard about last month, kind of sharing their insights and making sure that we're staying on track with where things are going from the larger quality world. And then finally, for the Flex monitoring team, the team at the University of Minnesota, at the University of North Carolina, and University of Southern Maine, all of their work that they do every year, just giving us the data that helps us look at critical access hospital metric trends more broadly, and then specifically the reports that help provide insights on what are some good models that are going on in critical access hospitals, for instance, around behavioral health. Or now it's coming this next year related to COVID-19 impacts, whether it's on the financial side or the clinical side. So kind of talking about on the Flex side, what has happened this past year, we, because of COVID-19 impacts, have kind of shifted things a little bit. We gave you the opportunity to provide less information for us this time, knowing all the other things that you had going on. Some of that was related to the SHIP COVID-19 funding that you managed to get out the door in record times. I know a lot of you are working on that as well. So we'll do a larger kind of FY20, FY21 update later this fall, talking more specifically about the Flex program updates. But just wanted to put this little teaser in here for the PIMS data from FY18 that Tori will be sharing with you at a later date. I think one of the interesting things you can see here is how much the finance and operational in that area, the increased participation for critical access hospitals in that area. So look forward to more on that. For today, just wanted to encourage you to be present in the present. I know it's hard when we're all teleworking, alone in our offices, dialing into meetings. It's easy to get distracted. So wanted to encourage you all to just spend as much time as you can being present in these meetings. One of the great things about these meetings is being able to celebrate those successes. So really listening to what all these presentations are about from your colleagues in other Flex states, figuring out how to have an impact in a certain area and talking to you about how they did that. So these breakout sessions are great for celebrating those successes. Also engaging with each other. I encourage you to send messages through the chat, follow up via email if you see someone online who you normally walk over and say hi to. Connect with old friends. If there's someone new whose name you don't recognize, reach out and get to know them a little bit that way. And also the great thing about the Flex meeting is just getting ideas to inform your own work as well. So if you're hearing about best practices or someone has a similar challenge that you think would be good to try to implement their solution in your own state, just jot that down so you can take that away and work on that over the next few months as well. And then finally, looking forward, I think with COVID-19, there's so many challenges that hospitals are currently facing. And, from those come some opportunities, such as, the amount of telehealth that's kind of available now, given some of the waivers that are out there. But then there's financial challenges that hospitals are facing even more drastically because of the COVID-19 impacts, kind of figuring out what to do there. Is there anything through Flex that we can be doing to shift either within the program nationally or within the activities that you're working on within your states, and kind of figuring out what are some of the shorter or longer term challenges that we might be facing as well. One of the other challenges that we've heard about too is with all the quality reporting, and hospitals focus so much if they're really trying to work on addressing COVID within their own communities. How does that shift how they're thinking about some of the MBQuip measures that we have? So how does that inform kind of in the short term, how we can be supporting you through Flex on that? Or in the longer term, what does that mean for how quality measurement may shift over time as we think about the MBQuip refresh? So going forward, and I look on this slide and I put FY 2020 and it's actually FY 2021 that's coming up. But we're going to be working to build up our Fort Flex team now that we're fully staffed, and appreciate all of the guidance that we'll be reaching out to all of you to help get us up to speed again on your programs and kind of our larger Flex work. And really appreciate the opportunity to be with you here today to kind of get a jump start on a lot of that as well. So Thank you for your time. Thank you for being here. If you have any questions, please feel free to reach out to me. And now I'll turn it back over to Sally for the great policy panel that I always look forward to every year.